to grab something to eat, just grab something real quick and come on in. Fortunately, we have these lovely tables so that you don't have to hold it on your lap.
I can hear you.
Just to get everybody starting to settle down.
Oh, no shame. I'm sharing with everyone here.
There we go.
Yay!
All right. I want to welcome everyone to the University of San Francisco. My name is Eileen Frey-Bowers, and I have the great pleasure of being the Dean of the School of Nursing and Health Professions here at the university. I have a lot of my faculty and staff and students in the audience, and they know that they're supposed to clap. But I want to warmly welcome everyone tonight, especially our guests from the Western Institute of Nursing and the annual conference, those of you who are attending that. Thank you so much for joining us. I also want to welcome our alumni, any family members, any community members, our partners, and any friends of USF who have joined us for this very special occasion. It's good to have all of you on campus gathered here today, and it's a great honor to be with you in community. I want to tell you just a little bit about the Crawford Lecture. The Crawford Lecture started in 1984. The University of San Francisco School of Nursing and Health Professions was a recipient of a gift in honor of Geraldine Crawford. She herself was not a nurse, and she herself was not an alum of USF, but she had been cared for by USF-educated nurses. The first Geraldine Crawford Distinguished Nursing Lectureship was presented in 1985, and it was open to all students and graduates and health professionals in the community, and it has remained an annual event since that time. Today, we have the honor and the pleasure of having Sarah DiGregorio serve as our distinguished speaker. Sarah is a freelance journalist who covers healthcare and the critically acclaimed author of, and she is the critically acclaimed author of Early, An Intimate History of Premature Birth, and of Taking Care, the Story of Nursing and Its Power to Change Our World. For those of you who have not read the book yet, please run to your nearest bookstore, a local bookstore, by the way. Go to your nearest bookstore and buy a copy and read it. It is such an important read for everyone to learn about the nursing profession. So after Sarah's presentation, we will have the opportunity to have a conversation with her, to do a deep dive into some of the aspects of care that she covers, and then we will have time for a few audience questions. So now, please join me in giving a very, very warm welcome to Sarah DiGregorio.
Thank you so much, Eileen. I just appreciate your kind words so much. And thank you also to Carolina and to everyone here at the University of San Francisco who's done so much to make this happen. And I also want to acknowledge the memory of Geraldine Crawford, who I am not surprised to hear that she wanted to endow this lecture, even though she wasn't, even though she was not a nurse. Because she was cared for by nurses. And I'm about to sort of tell you what I know about that. I'm going to switch mics. Testing, yes. I think that's a bit better. It wouldn't be a lecture if there weren't a little IT problem, you know what I mean? So, I am here today to talk about the radical power of nursing. And as Dean Eileen so kindly said, it is based on my book, Taking Care. And the first thing that nurses often ask me is, how did you, a non-nurse, come to write a book about nursing? And I have a couple different ways of answering that question, and they're all true, right? I have personal reasons and I have professional reasons. My personal reasons are that I grew up as the only child of two parents who were very chronically ill. So my mother was diagnosed with metastatic breast cancer when I was 5. My father struggled with substance use disorder as well as Crohn's disease for his whole life. And so I really grew up navigating the American healthcare system with my parents and on behalf of my parents. And I experienced that system like a labyrinth, which is, I think, how many people experience it. Even those of you who work in healthcare often find this, I think. So, this maze of hoops to jump through and see, can you get this physician to call that physician, or does this pharmacy have that medication, and will it be covered by insurance? All of those questions. And then, as I got older, in 2014, I gave birth to my daughter, Mira. I gave birth to her prematurely at 28 weeks, and again found myself in these very complex healthcare situations, environments in the NICU with my daughter for several months. And I'm very, very fortunate to say that she is now a healthy, happy 11-year-old. Thank you. But what all that taught me, really, I say I lived my way into a deep appreciation of nursing work. There was the nurse who made sure that I was with my mother when my mother was actively dying. Without her, I would not have had the courage to be in that room. There was the NICU nurse who really taught me how to be a mother to a baby with complex medical needs, how to love a baby who's on, every life support I had ever seen. There are nurses who never touched me once, but who saved my life. And I mean that quite sincerely. So that's the personal way that I came to an interest in nursing and to an understanding of the deep importance of nursing for everybody. And then the professional reason is really, as a journalist and someone who loves to find stories about people, nursing is full of great stories. I mean, incredible stories of bravery and difficulty and triumph. And we know that the media does not do a great job reflecting that, right? There was actually a study that found that nurses are quoted as experts in healthcare stories in the media something like 2% of the time. And that is a really abhorrent mismatch for what we know is true, which is that nurses provide the vast majority of patient care, right? So I could see that these were stories that were not being told. And so as a professional, as a writer, I was really very excited to embark on this project. And so that is the long answer to how I came to write this book. And here I am tonight with you all, just incredibly grateful for this warm welcome from the University of San Francisco, which is clearly a place of great excellence and warmth. So thank you for all being here with me this evening. So the way I think about the uniqueness of nursing and nursing expertise, and what I came to understand about why nurses so often are able to change the world, is really because nurses, as you all know, work at this nexus of knowledge about the body and relationship expertise. So of course you have this tremendous amount of knowledge about the body, about biomedical science, pharmaceutical science, but you also are practicing that, are implementing that in deep relationship with people and understanding where they come from, who are their families, what kind of housing do they have, what kind of access to food and water do they have. All of this, right, as you know, is within nursing practice. And I think that it is that nexus, that potent nexus, that makes nursing knowledge and nursing insight completely unique in the world. So I want to give you an example of what I mean when I say the power, the really unique power of nursing is in relationship. I want to tell you the story. I think you all can see. This is Jennifer Canvasser and her son Micah and their nurse Nick. So Jennifer Canvasser gave birth to her twin boys at 27 weeks. And one of them did very well and spent a couple months in the NICU and went home and was healthy. Unfortunately, Micah, the baby you see here, contracted necrotizing enterocolitis, which, as some of you know, is a disease that strikes the intestines of premature babies. It's very serious and can be fatal. And Micah really struggled. He had been through multiple surgeries and he was in the NICU, still requiring supports for many months. And in the process of this hospitalization, Jennifer and Nick became quite close because Nick was the primary nurse for Micah. And one of the things that is so difficult about being in the NICU is that all of the things you imagine when you're pregnant, you're thinking, ooh, what will I dress them in, right? Who will I invite over to meet them when they come home? Where will they sleep? How will I feed them? You know, all of these decisions that you're making as a parent, it's really part of sort of your self-conception as a parent, becoming a parent. In the NICU, none of that is under your control. None of that, right? It can be very, very hard to feel like any kind of mother when your baby is in the NICU. So Jennifer had conveyed to Nick that it made her really sad that Micah hadn't been outside. So he had never, in all his months of life, been able to go outside, feel the sun on his skin, feel fresh air. And Nick really heard her. He really heard her. And he went to his colleagues and they came up with a plan. Because of course, it's not so easy, right, to take a baby who needs intensive care and bring them outside. There's a reason that they're in intensive care. They came up with a plan so that Micah could have the supports that he needed while also allowing Jennifer to bring him outside. And I think if you can look at this picture of Jennifer here, in the outside photo, you know, I don't really have a word for what is on her face there. You know, the level of joy and love that is there, that is made possible by that, is truly something that I don't have the words to describe. Unfortunately, Micah did pass away in the NICU just before his first birthday, and I'm sorry to start this talk with a sad story, but it is also a beautiful story. Because I probably don't need to tell anyone in this room that sometimes the worst things happen. But just because the worst thing is happening doesn't mean that there's nothing more that can be done. It doesn't mean that there's nothing more that can be done. It doesn't mean that there's no more care to give, right? And the reason I always tell this story, and the reason that Jennifer gave me permission to tell this story, is because she wants you all to know that what Nick gave her was the ability to feel like Micah's mother. And that is something that nobody and nothing can take from her, that she felt like his mother. She was able to make a decision for him, have this experience with him, and that's something that Nick made possible for her. And she carries that with her always. Now, this is a more dramatic story of this kind of relationship, right? It's an end-of-life story. But these, I can tell you from personal experience and also from talking to many, many people, that this kind of encounter, this kind of relationship that people have with their nurses, these things are happening everywhere. They're happening in the PACU, and they're happening in the ER, and they're happening at home visits, and they're happening in substance use treatment centers. When you take the time to listen to someone and meet them where they are, that is something that they carry for the rest of their lives, even if you never know it. And I can tell you that that is the truth. So when I say the power of nursing is in relationship, that's the bedrock of what I'm talking about. And I think about this relationship, the nurse-patient relationship, as something really alive, like almost like an electric current, because there is information and emotion and energy going back and forth, right, between the patient and the nurse and the nurse and the patient. And the nurse is getting information that's useful for their practice, and the patient is getting cared for and learning about their condition. And I think that it is in these moments that you really see the way that nursing insight becomes incredibly unique in incredibly powerful. So one of the ways that I think about this is actually came to me from an Australian nurse named Dr. Jill White. And she said, the thing that's really magical about nursing is that nurses see near and they see far. So nurses see the forest and they see the trees. And what do I mean by this? I mean, you know your patients, and you know your patients, and you know your patients, and a year, 5 years, 10 years down the road, what do you know? You know the causes of suffering in your community. You know, and you notice, and you are the first to notice, the problems that are causing suffering in your communities. Because nurses are always the ones, right, who notice the problem before anyone else. And that could be in the context of watching a patient's mental status, right, and making sure, are they still oriented? But it can also be in broader ways, in this broader insight that you have. I'll give you an example. I spoke with a school nurse in New Jersey, and she said, kids were coming in, little kids, coming into my office, and they were having stomach aches. And I couldn't figure it out. There wasn't anything going around, they weren't throwing up. I'd be asking them, what did you have for breakfast? Do you need to go to the bathroom? All those questions. And she kind of couldn't figure it out until she started engaging them in more conversation. And she realized that there had been an uptick of gun violence in that community. And those kids were anxious. They were having a stomach ache because they were anxious. And who was the one who figured it out? It was the school nurse who figured out that this is impacting our children this way. Now, does that mean that the school nurse can fix it right away? Of course not. But what do nurses do? They make a care plan, right? So she can bring in, who needs to know about this? The principal, the teachers, the local pastors, the local shop owners. Listen, this is affecting our children, right? We need a plan. So that's what I mean by seeing near and seeing far. You see your patients, and then you see what's happening in your communities. This actually also really relates to the founding of modern hospice care, which was founded by a nurse in Britain around World War II in Britain. She cared for a man who was dying of cancer. And at that time, pain was not well managed. The physicians were very concerned that people would get addicted to painkillers somehow as they were dying of cancer. And this experience that she had with this patient who she became very close with gave her the conviction that she needed to change the way that dying patients were cared for. And do you know what she did? She actually went to med school and became a physician so she could bring a nursing perspective it was like she was like a mole. She brought her nursing perspective into medicine because she knew she needed to be able to change the way the medications were prescribed, and she wanted to do that, and she did it. And she established the first modern hospice care center where people's pain was treated, where visitors were encouraged, where she said, you live until you die. We honor your humanity as long as you are here. And that is exactly what I mean in terms of you see your patients, but then you always know, you know more than that. You can see far as well. And I think that's why nurses have often been such powerful change agents. Now I want to rewind just a little bit. When I first started working on this book, I thought, yeah, okay, I guess I'll probably have to start it in Victorian England because that's when Florence Nightingale invented nursing. And Florence Nightingale didn't invent nursing. I think we probably all know this. It's not to denigrate Florence Nightingale, but she 100% did not invent nursing. I then realized, when we say that nursing is invented by one person in the 1800s, doesn't that make nursing seem very small? That it could be invented by one person? Nursing is from everywhere. Nursing is forever, and that is quite true. So when I started looking back, I realized that nursing actually predates written history. There are examples in the fossil record of people who survived illness, injury, even paralysis, because they had care that was provided to them by community members. Now, whether or not that was a family caregiver, a community expert. It really doesn't matter, because the point is that there has always been someone in a community who has taken on the knowledge available at that time, right, the care available at that time, and has used that to help those who need it, those who are vulnerable. And the fact is that human societies, when you think about it for a second, how could human societies have grown and flourished without nursing, right? How would it be possible? And when I say nursing, I mean very specifically nursing. So it was not that I was looking back in history and thinking, oh, any care given by a woman is nursing. Not at all. In fact, men have always nursed, always. They continue to nurse, they have nursed forever. But I was thinking about very practical, hands-on care that is rooted in the community, care that is about prevention, about health education, about advocacy, and you can find those threads and you can follow them all the way back. And I think it's really important that nurses, and actually that everybody know this, that this is something that is very much a part of the human legacy. And why do I think it's so important? This quote is so wonderful, I think, because it really encapsulates this. It says, "Our past contains important lessons for our present if we are willing to pay attention. An archaeological focus on health-related care completely overturns the notion that society has evolved by embracing a winner-takes-all, survival of the fittest approach to health and welfare policy. A defining hallmark of the human species is our capacity to care, to support each other in times of need." Right? And it is true, right? It is really, really true. And I think we have a choice, because of course it would be equally true to say that a defining capacity of humans is to go to war and hurt each other and enslave each other. That's all true too, right? We can't make it not true. But this is equally true, and we have a choice in terms of how we think about ourselves. It is natural for us to care for those most vulnerable among us, knowing that we are all vulnerable. It's not like, oh, I'm sick and you're well. We all need care. We all need care. And without nursing, human societies could never have grown and flourished the way that they have. And we can choose that. We can choose that even if you're not a nurse. You can still choose that way of thinking about humans. Now I'm going to tell you a little bit about some nurses who have changed the world. So this is Lavinia Dock. She was born in 1858, and there's a lot to say about Lavinia Dock. She nursed in a yellow fever epidemic. She wrote the first best-selling nurse textbook. She did a lot. But what I want to highlight here today is her work for women's suffrage, so her work for getting women to vote. It was very controversial at the time that she was alive in the early 20th century. She actually was arrested twice for trying to vote and thrown in a brutal prison, strip searched and beaten for doing that. Now, at that time, the ANA, it was actually a precursor to the ANA. But the ANA decided to get together and decide what their position would be on this big political issue of the day. Should women be able to vote? So all these professional women got together and they voted that they shouldn't have the right to vote. And Lavinia Dock was infuriated by this. And she was infuriated not so much, she was infuriated as an American woman, but she was very specifically infuriated as an American nurse. Because she said, nurses know the causes of tuberculosis. Nurses know the causes of illness, and if we can't participate in the political process, then we are, in a sense, wasting that knowledge, that we have a responsibility to act on that knowledge. I think this quote is really interesting because she's speaking to a tension in nursing that I think we think of as very modern, but in fact, as we can see, it's actually quite old. The idea that, well, just keep your head down and focus on patient care and don't speak up about things that are controversial. She's saying, no, if you don't speak up, in a way you are losing your usefulness as a nurse. If you know the causes of suffering, then you are obliged to act upon it as a nurse. So that is part of nursing. Nursing is love in action. So this is Lillian Wald. Probably many of you know about her. She was one of my very favorite nurses to learn about. She was active also in the beginning of the 20th century, and she was active in New York. And she had just graduated from nursing school when this little girl burst into a classroom where Lillian was teaching, and she said, "My mother is bleeding, can you help me?" And Lillian said, "Okay." And so she went through the very crowded streets of the Lower East Side. She went to this family's apartment, which was a tenement apartment. At this time, the Lower East Side was one of the most crowded places on earth. This is a neighborhood in Lower Manhattan. And it was filled with immigrants from Russia, from Italy, from all over. And people were desperately, desperately poor, and there were no protections, right? There were no building regulations. There were no food regulations. Illnesses spread, fires often burned people's homes down. It was a really difficult place and time. Lillian Wald comes up to this apartment and sees this woman is hemorrhaging after having given birth, surrounded by her small children. And Lillian Wald somehow stopped the bleeding, saved this woman's life. And she said this family kissed her hands, because this family absolutely knew other women who died exactly this way, but they probably had never experienced care like this. That experience was just as important for Lillian Wald as it was for the family, because now Lillian Wald knew something, which was how people lived and what they needed. And so she got together with a colleague from nursing school, and they literally just moved to the Lower East Side. This was an insane thing to do for like a couple of young unmarried women at this time, to just rent an apartment on the Lower East Side, and they started providing nursing care on a pay-what-you-can basis. And this turned into the first visiting nurse service in the country. It turned into the VNA of New York City. But she didn't stop there. This is the list of her accomplishments could take all night. So I just want to tell you one thing. Lillian Wald saw that children were playing in the street, and there were dead animals in the street, and there were carriages and horses and all this. It was dangerous. Kids were getting hurt. But Lillian Wald said, play is a matter of dignity for children. So she opened the backyard of the Henry Street Settlement House, turned it into a playground, and then also pressured the city of New York to establish a public playground for all children, so that children could have a safe place to play. Now that sounds like, was that philanthropy on her part? No, that was nursing, right? It was nursing, because she knew that kids were getting hurt, and she knew that there was something she could do about it. This actually is a woman who you will not find in Taking Care, but she is in the new book that I'm working on. Her name is Elizabeth Rio-Quintanilla, and she was a very young nurse when war broke out in France and when the Nazis invaded France. She was working at a hospital in Grenoble. And Gestapo officers would bring resistance fighters to the hospital that they had tortured, and they would ask the nurses to care for these resistant fighters enough so they could take them back and torture them some more so they wouldn't die. What did 20-year-old Elizabeth do? She put a sleeping drug in some coffee for the Gestapo officers, served it to the Gestapo officer like a nice young French woman, and then when the Gestapo officer fell asleep, she helped the resistance fighter escape. She did this 3 times before she was found out, and she had to flee to the mountains to become a nurse actually for the resistance. So her work put her in this position where she could do this extraordinary thing, and how much courage that must have taken. Moving towards the present, I am mindful of time, but in more ways than one, I guess. But moving into the present, this is Stephen and Karen Wickham. They are married nurses, and I met them in Tennessee, where they run a diabetes management program for rural communities there. What I love about their story is that they worked in a hospital for many, many years together, and what they noticed was that people with type 2 diabetes would come in they get stabilized, they get sent home. And then the same people would come in a little sicker, get stabilized again, go home again. And this cycle would repeat. And people would end up dying of complications of diabetes after suffering for years and years and years. And they knew that this was a cause of suffering in their community, and they told me that, in the discharge planning meeting, there's only so much that you can do, right? They really wanted to help people in a more direct way. So they came up with this program, which they offer for very little money. And it's an 8-week program. People come once a week. And I went to one of these meetings at a church hall in Tennessee. They hold them in church halls, and they hold them in town halls, and they hold them in libraries. It's very, very accessible. And people come in and they weigh themselves, they take their blood pressure, and then they have their own goals, right? They have their own goals that they have set. And they talk to each other about, have they met their goals? They get a lot of encouragement. And then they sit down and they have these education sessions, which the day that I was there, they were learning about different types of starches. So the Wickhams had made a pasta salad that was made from pasta that had been boiled, cooled, and then mixed with vegetables. And they learned, as they were eating this and looking at the recipe, that when you cool starch, it turns into a more resistant starch that won't up your blood pressure as much, right? And this recipe that the Wickhams were giving out was made with ingredients that they could all find at the Dollar General. So it's rooted in real life, that care. It is rooted in real life, and it is not shaming, right? And it also has to do with everyone being together in a group. We're all dealing with this. We have our own goals. We support each other. And they get education and really actionable information from the Wickhams. And I thought, I don't know that, the level of care there for people's actual lives was astounding. And I think that is truly changing the world. This is Farah Forrest. Some of us in Brooklyn are lucky enough to have her as our representative, not me, sadly, but some people. Farah Forrest was an infant and maternal health nurse in Brooklyn. And as such, she saw a lot, right? She saw a lot. She loves her. She actually still works clinically, and she loves her job. One of the things that she saw was an uptick in congenital syphilis happening in her community. Well, she ran for office because she was getting a little frustrated that she could only help one person at a time, and she wanted to go into policy to be able to change that. Lo and behold, she finds herself at a budgetary meeting, and there's a line item for syphilis education and testing. And everybody else in the room, it did not matter if they were a Democrat or a Republican, they were like, syphilis? No one gets syphilis anymore. Why is this here? And she said, and she told them the statistics. She knew the statistics backwards and forwards, but she didn't just know the statistics, she also knew the suffering. She knew what it looks like, she knew what it's like for women and their babies. And she was able to educate her fellow lawmakers, and they passed that line item. So my wish for all of you is that you be in the room when these decisions are being made, because you know things that other people don't know. Finally, I want to tell you about Marcella LeBeau. I was working on this book. I started working on this book during COVID, and it was really hard to get. Anywhere, of course, as it should have been. And I did a lot of reading. I did a lot of phone interviewing, and I had come across Marcella LeBeau because she was one of the last remaining World War II nurses. And she was also a Lakota elder who lived in South Dakota. And I really wanted to interview her, so she said yes. And so once we were vaccinated, I went there to interview her. And here I come with my little recorder and my list of questions, like I'm in charge of this interview. And I was not in charge of that interview at all. So we sit down, she's so lovely. This is a picture I took of her when I was visiting with her. She said, oh, I want to go for a drive. And I was like, oh, okay. So we get in my rental car and we're driving around to a small town of Eagle Butte, South Dakota. And she points out the tribal council building, and she said, oh, when I was on the tribal council, I was the one who wrote the smoking ban for the reservation. That we banned, we were the first Indian reservation to ban smoking in public places. She said she had to propose this every year for 10 years. She did things like put pictures of autopsy diseased lungs on the wall. And people would be like, well, that's really unappetizing. She got herself a gas mask. She was really trying to make her point, and finally it passed. She told me that. We went by a community garden that was for teens in the area. She said, oh, I was part of making sure that this happens. I want to connect the teens with our traditions of growing our food. And she was describing some of the difficulties that young people have on the reservation. We went by the new hospital, which was actually where she had worked. She had worked at the Indian Health Services Hospital for her whole career after she came back from World War II. But recently, the hospital had been torn down, and in its place was this beautiful little building that had 8 beds. 8 beds. Previously, it had 30. And she said, I don't know how much care you think we can give in 8 beds, and the next nearest hospital is 2 hours away. And then we went by the new jail, and she said, that has more than 8 beds. And what I realized as we were driving around was that she was educating me about nursing. She was telling me that she didn't need to describe all the things that she had done at the hospital. She was telling me that her scope of practice was life, because she loved her neighbors, because she cared for her neighbors, that was her nursing. And she was even nursing when she explained that to me so that I could bring her testimony into my book. Finally, I want to leave you with this quote, which I think is so beautiful. But before I read it, I want to just remind you all that the word radical, we think of it now as meaning very political, right or left. But the etymology of the word, it means at the root, which I think is quite apt here, at the root. Nursing is a profoundly radical profession that calls society to equality and justice, to trustworthiness and to openness. The profession is also radically political because it imagines a world in which the conditions necessary for health are enjoyed by all people. So I really thank you for imagining that world. Thank you for imagining that world, and together we can make it possible. Thank you.
Thank you so much, Sarah. Again, let's all thank Sarah again for So before we get into... Hello? So before we get into specific questions, I just want to offer my own personal comment regarding the reading the book. I've read many books on nursing, and what strikes me as being particularly notable about your book is your attention to the aesthetics of care. You write beautifully about the small, seemingly mundane tasks that nurses do. The washing of a patient's hair, the holding of a hand, and how those moments are actually where the power of nursing resides. And so I just wanted to share that I appreciate that so much as a nurse.
Thank you. I appreciate your work more than anything.
We're gonna share. Nurses, we improvise, right? Yeah.
I think she's got it.
I'm not one of those. The big question is, can I make it work? I don't know.
All right. Well, here we go.
Okay.
several historical figures in your talk today, and I appreciate Lillian Wald. I talk a lot about Henry Street and so forth, but I'm wondering, who is a historical figure that you uncovered in your research that offers a more inclusive or radical vision of what nursing can be?
Yeah, thank you for that question. There were so many. I mean, it was an embarrassment of riches, truly. I mean, I could have written this book for the rest of my life and then we're done. But I always want to mention Mabel Stobers, who was an incredibly strong nurse. She was actually the head of the professional organization for Black nurses during World War II. And at that time, the Army Nurse Corps had a racist quota system where they would only admit a very, very small number of Black nurses, despite the fact that Black nurses, although there was a lot of segregation, Black nurses had the same education and passed the same test to be an RN. Nevertheless, these American nurses who wanted to serve their country were being told they couldn't. And at the same time, there was a nursing shortage. Which always makes me want to ask, like, what is a nursing shortage about? Black nurses were being turned away from recruiting stations when they went to go sign up. And Mabel Stobers she was really in relationship with other nurses very specifically. She would take those stories of nurses being turned away, and she kept a file of them, and she would send them to the Secretary of the Army. She would send them to the Secretary of the Navy, and she would say, I see on the front page of the New York Times that there is a nursing shortage. There are field hospitals that don't have a single nurse. Parents all over the country were terrified that their service members were going to die needlessly because there were no nurses. And she brought this into the halls of power. She actually went to Eleanor Roosevelt and talked about it. She was in every meeting, whether she was invited or not. And she would say, I fail to see how we are defending democracy abroad when we don't have it here. And by the end of the war, they had decided to do away with these racist quotas, and they would admit any nurse who was qualified, who wanted to serve her country, right? And what I love about Mabel Stobers is that she absolutely knew that this was about patience, it was about patriotism, but it was also about Jim Crow, and it was about breaking one link of Jim Crow, because once those nurses came back, having served their country, she thought that would change the way that they were seen both as nurses and as American citizens. So I always want to honor her.
I really enjoyed that description in the book, that story. The power of nurses, like what you described, that really looking at their communities and what the change that they can bring about sets in motion so much more change. So, you in the book, you trace nursing back to the very beginning of human history. Why was it important for you to go back and to really think about, framing nursing as an essential evolutionary trait rather than just a modern job? I think I've never read about that in other books in nursing.
Well, it was a process of discovery for me, and I slowly came to this realization or thought that, because I was very cautious about how to define nursing and how to define historical nurses when, we didn't have the licensure that we have today. And so I started thinking about it in terms of prevention, in terms of very hands-on practical care, intimate care, care in the community. And I realized that archaeologists had uncovered these skeletons that spoke of this story that they had received nursing care. And I thought it was just such an important aspect, because I think it's really important that we all think of humans as existing in this legacy. even those of us who are not nurses, that we actually really need each other in so many ways, and we need nursing care. And if we make nursing care impossible, we simply will not be able to flourish. And that's not my opinion. Like, that's just what is. And so I think it needs to be understood as such. And I also, sometimes I say, and I'm always very cautious about how I talk about nursing in front of, with nurses, because I know it's yours, right? And also I think it is like a public role that everyone is invested in some way, right? How do we decide we're going to care for each other, right? And I think it is the skilled, expert, educated expression of a fundamental human impulse, which is to care for each other the best that we can.
Thank you so much. I've often said to my students, to faculty, they think nursing is a public good and should be appreciated as such and should be resourced as such.
Yes.
So I'd like to shift a little bit here, and I do want to address sort of this issue of the hero or heroine narrative or trap, as you refer to it. During the pandemic, nurses were called heroes. You've talked about how this narrative can be actually harmful. And can you explain how the hero label is used to justify the exploitation of nursing labor?
Yeah, it really is. Because I was in New York City during the pandemic, I felt this upwelling of emotion, and that emotion was really genuine. It was really genuine. But it didn't have anywhere to go because people don't understand nursing, right? And so I think that people are, because they don't understand the complexity and the expertise of nursing, and because 90% of current nurses are women, it very much falls into this, they're like a mother, or they're like a daughter, or they're going to be there for me, they're going to take care of me no matter what. And it's not, it's harmful because it is not, first of all, understanding what nursing is and what nurses need in order to care for the public. And so I think that emotion ends up kind of with nowhere to go and nothing to hold on to. It's, let's send them a card or let's call them our heroes. The truth is people really, really do think of nurses as heroes. That is true. But that ends up justifying, well, if you can do anything then with anything. You can show up even though you don't have PPE. You can show up and you don't have the protections or the staffing or the supplies that enable you to do your job. And if people don't understand what your job actually is, then they don't understand that. They think it's like something that is coming out of the goodness of your soul. And many nurses have different relationships to that, right? That you might feel it as a calling. You might feel it as something that is soul work for you. And also, it is your profession. It is an independent discipline, and you need certain resources to do it. And as long as people don't understand that, I think we find ourselves in a difficult position.
Thank you so much for using the term independent discipline. I really appreciate that, and I think my colleagues in the audience appreciate that too, because I think for so long in history we've been linked to medicine and not recognized for our distinct body of knowledge, our distinct science. And of course, we have lots of attendees from the Western Institute Nursing Research Conference here today, and that's what they're presenting is nursing science.
Right, and actually that makes me think of sort of one of the things I neglected to say, which is that people think of nurses as having arisen in relationship to doctors and hospitals. when in fact nursing predates both of those things.
Absolutely. So I do want to open it up to the audience for questions, but I'll have one last question for you, and then we'll open it up. So, it's well known that the population is aging, and the demand for care is exploding while our workforce is shrinking. So, based on your research, what is one systemic change that you think could save our profession from collapsing under the weight of the changing healthcare system, the needs of an aging population, and all of those changes?
Yeah, that's a very good question. I don't have the answers, but my first thought from what I've heard from nurses is that there needs to be a solution around staffing. There just has to be. And here in California, I know it's not perfect, but I have talked to nurses who say that working here is absolutely fundamentally different than in any other state because you have a staffing law. Now, I'm not necessarily in favor of, a law that is going to micromanage how you practice, but I do think that until hospitals are willing to actually staff properly, which they have shown themselves over and over and over again to be unwilling to do this, there's going to have to be a federal law that mandates minimum staffing levels, not just at hospitals, but also at assisted living care facilities, at any place that is caring for elders in every healthcare setting. Because I think that hospitals have shown that they cannot be trusted to do it without being forced. And it's not a perfect solution, but something has to happen. I mean, something just has to happen with the staffing problems.